This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. So we've been doing this Tuesday Tips What to Expect series for the last couple of weeks. It is more focused on the patient experience. So what does the patient experience? And I go through usually those symptoms and why they happen and what to do to make them better or to go through them, okay? So we did already like BBL, mommy makeover, implants, breast procedures. So if you want a little bit more information about that, check that in my page. And today we're going to be talking about brachioplasty. Brachioplasty or arm lift is a very common surgery, especially for massive weight loss patients that have excess skin in the upper arm, okay? So it's, a lot of people ask me the difference between an arm lift and liposuction and why do one or the other. It's basically dependent on how much excess skin you have, okay? So if you do have a little bit of excess skin, mild to moderate, and it's mainly fat, so if you're like pinching it and it's thick, but not a lot of movement of the skin, then you may be a candidate for liposuction to improve the contour. But liposuction only empties fat. Your skin needs to retract to actually see a difference in contour. And there's something called BodyTite. It's basically radio frequency energy that can be added while we're doing a liposuction case. So a lot of times I recommend doing BodyTite to the arms because usually the skin in the arms is very thin, doesn't have the contractility ability of the rest of the body. So it's good adjunct to put BodyTite in that area to improve that skin tightening, okay? But again, that is only for patients with mild to moderate skin laxity. If you have moderate to severe skin laxity, so if you're waving and the arm is flapping, that usually means that you have more skin laxity, okay? It's not just excess fat. So the best procedure to actually see a difference is an arm lift or a brachioplasty. The other question is, do I really need the scar? So unfortunately, the only way of removing skin is by leaving a scar behind. But what are the things that I do to try to make that scar better? We'll go over that, okay? So an arm lift usually involves an incision from the elbow to the armpit. I usually put it in an area of the arm. So the arm is a cylinder. It's impossible to hide it completely because it rotates. So it doesn't matter if I put it in a certain point. If you rotate your arm in a certain angle, you are going to see the incision. But saying that also, it's important to position it in a place that it minimizes the show. So what I do, and I've seen, and if you guys go to my Instagram page, you can see a lot of my before and afters from brachioplasty is that I try to put the incision, if you're like this, in the lower aspect of the arm. Instead of putting it right here, a lot of surgeons tend to put it here because if you're like this, it hides on the inside. But if you're like this, then it shows. So that's why I try to put it up like on the bottom. So if you're like this, rotated anteriorly, your forearm, it's still hidden. Of course, if you go like this, you're gonna see it on the back of the, on the posterior view. But I mean, at least in the front view is hidden in the lower part and inner part of the arm, okay? So what are the things? Swelling. Unfortunately, swelling is a very big component of the post-op in this surgery. Why? The arm is a cylinder, okay? So if we're looking at the arm in a cross-sectional, so this way, the arm is a cylinder, bone is in the center, surrounded by muscle, we have the fat, and that excess skin, it's basically cut, and this is brought in and in to close it. And that puts tension in the entire arm. And because it's a cylinder, the swelling doesn't have other areas to go. For example, if you're doing a breast procedure, the swelling has room to kind of spread over the back. If you're doing a tummy tuck, the same. If you're doing liposuction, the entire torso kind of spreads with swelling. And the arm, it just concentrates in the arm. So the swelling tends to get very bad, especially in the forearm and hand, okay? So all the blood from the hand needs to travel back to the heart. And because this is so tight, this starts to get swollen. So what are the things that we do to try to minimize swelling? Number one, compression, okay? So the compression after the surgery is super important, okay? So the first week you're gonna be using an elastic wrap. Compression with the brachioplasty, it's important, but you can't overdo it, okay? Remember, again, it's a cylinder, and the nerves and arteries and veins that go to your heart go in that. So if you go ahead and you pull that elastic wrap and tighten your upper arm too much, you may cause venous or outflow problems. So the venous return to the heart is obstructed, and you get swelling, very massive swelling in your forearm and hand, and that is not good. So how tight? Good that it's compressing, but you shouldn't be like stretching it and going around it, because that's going to create too much tension, okay? So good compression from the elbow up to the shoulder, okay? The other thing is elevation, okay? So elevation up to shoulder level is okay. You shouldn't be elevating your arm above the shoulder for the first 2 weeks to minimize tension, but it's good to sleep with at least 2 or 3 pillows under it, so your arms are in this position while sleeping. If you sleep like this, you're gonna wake up with the arm very, very swollen, okay? When you get swelling that is very, very severe in the arm, you may start to get numbness, okay? That is the swelling, okay? We have a nerve, it's called the ulnar nerve. You may have heard of it because people call it the funny bone. If you hit in a weird angle, you get like a current sensation to these 2 fingers. That's because the ulnar nerve goes very superficial here. So because it's very superficial, any swelling or any excess tension is gonna irritate the nerve. So you may feel some numbness, some tingling in the hand. Elevation, compression to decrease that swelling. Other thing that helps is your diet. So afterwards, and this is after any surgery, you should be eating low in salt, okay? Salty foods are gonna increase swelling and worsen your recovery, okay? So the compression, like I said, the first week, you're gonna have that elastic wrap. After I see you on post-op day 5, I'm gonna check the incision. If the incision looks good, then you can start wearing your sleeve, okay? There are some compression garments that comes in sleeves and goes up to here. That's the one that you are gonna use for 6 weeks, 23 hours a day. So that means you're just gonna remove it to shower, to clean the garment. But other than that, day and night, you should be wearing your garment until 6 weeks. After 6 weeks, until 3 months, you're gonna wear it 12 hours a day, okay? After 3 months, it's up to you, okay? So let's talk about the scar. This is the area and the number one concern after a brachioplasty is the scar. I've seen patients tell me, like, I've seen the scars, they get thick, they get red, they get dark, I just don't want it. So the problem with the scar in the brachioplasty goes back to the swelling and cylinder thing that I explained. Scars get worse with tension. Anything that tries to stretch that scar, the cells are trying to heal it together and something external is pulling at them, so the scar gets thicker, darker, redder, you know? So things that minimize tension are gonna improve your scarring, okay? So this compression, the movement, trying to limit the movement up to shoulder level for the first 2 weeks, and also the compression, like I said, and the elevation while at night, the position when you're sleeping, all of that is gonna contribute to a better healing of the wound. Later on, or at 2 weeks, you're gonna start scar treatment, okay? And with every surgery is important, but with this one, it is extremely important. And when you're doing the scar treatment, you should massage the scar, okay? The problem with the scar, especially in the area of the axilla, remember, the shoulder joint is one of the most movable joints in our body. It turns almost circumferentially. Think about what other joint does this. So we need a lot of stretching and movement, and that scar may tighten if we don't give that movement. So at 2 weeks, you may start to rotate, and actually stretching exercises are extremely important. And when you apply the scar, go like this. pressure and kind of pull it apart to try to kind of stretch that scar, putting the ointment and stretching it. So that softens the scar, and also make sure that the product is being put in the scar, and the product and the results are more are penetrating better. Okay, so the other thing that it's important is give it time. Okay, scars tend to look darker or redder at first, and then they start to lighten. Okay, so don't get discouraged if at 3 months post-op you see that the scar is still thick or is darker than you like. Okay, continue the massages, continue the stretching and the scar treatment, and wait at least up to a year. A year out, scars tend to mature and change a lot. Okay, so give it time. And the other very, very important thing about scars is UV light. Okay, so sun exposure is just gonna make your scar get darker. Okay, healing cells that are in the scar are more metabolically active, so they're reproducing and are more active, so they absorb more light. And if you are exposing your scars to sunlight early on, they may get darker. Okay, so at least for the first 3 months, try to avoid direct exposure. After 3 months up to a year, you should be applying sunblock over the scars, at least an SPF of 50 to get good protection. Okay, and that's up to a year. Okay, I think I went over the most common parts of the brachioplasty recovery. I'll get to some questions now if you guys have.
Thank you. Can you add this to a mommy makeover procedure?
Yes, that's a very good question, and it's a very common add-on. Actually, today I did one. Dr. Earl calls it the trifecta perfecta.
Yeah.
It's like 3 procedures in one: breast procedure, tummy tuck, and arm lift. So of course you have to be a good candidate, meaning that medical conditions should be stable. Your BMI should be less than 33.5. Even better if it's 30 or less. And yes, we can do the 3 procedures.
So if you're getting lipo if you're getting lipo in combination with the brachioplasty, is the total amount of fat that can be removed is it combined with the brachioplasty?
So good question. So with a brachioplasty is an incisional procedure. So yes, it has the same limits when you're combining lipo to other areas. With the brachioplasty, it has the same limit as a tummy tuck or breast procedure, that I am able to only remove 1 liter of fat. Okay, so it's usually better to combine it with other open procedures like a tummy tuck, breast, back lift. I in one patient I did an upper back lift and the arms. So it's better to combine it with other procedures. But if you're going to combine it with lipo, it just has to be a small area because it's 1 liter max removal.
Thank you. All right, a few more.
Yeah.
Massages, are they required with this?
So no, I don't recommend massages. If you want to do massages, at least 2 weeks out. Okay, remember that the incision needs to heal, and I don't want any tension there. So putting extra tension and massages on the scar may open up too early.
All right, question about body tight. How long should you wear compression on your thighs after body tight?
So good question. Body tight is radio frequency energy, and it can be given to the thighs, arms, and other areas of the body. Remember that it lasts, or the effect takes up to 6 months to see a final result for the body type. Okay, so it works by giving that radio frequency energy and basically contracting the skin, but it's a slow process. Okay, compression wise, you should follow the same as liposuction cases. So it's basically this pattern: 6 weeks, 23 hours a day, and between 6 weeks and 3 months, 12 hours a day.
Thank you. All right, let's see.
Let's do it.
2 questions and a comment.
Okay.
You are amazing, Dr. Vidal. I love my results.
Awesome.
How can you compress more on the lower stomach?
That's a good question, because gravity tends to kind of bring everything down, and the swelling tends to get worse before it gets better in the lower abdomen and in the triangle just above the buttock. Okay, so what can help? Extra foam sometimes helps. Adding a board stabilizes that lower abdomen and kind of helps with the compression in that area.
All right, thank you very much. I know you gotta go, and I think that's about it.
Awesome. Okay, thank you guys. You have one more? No?
Yeah, let's do one more. They just keep coming in.
You're thinking.
Sorry, they keep coming. Let's see. This one is this is brachioplasty, and I feel like she's asked it a few times, so let's just knock it out. We're here. The brachioplasty. Is there any other options for scarring?
Yes. So scarring later on, if it gets thicker, we can consider Kenalog injections. That's a steroid. I like to wait at least 6 weeks to start the first treatment, 4 to 6 weeks. Okay. And I take it on a case-by-case basis. After that, if you're a candidate for Kenalog, then it's a series of injections, so at least 3, and it's spaced out between 3 to 6 weeks apart, depending on how much the effect on the scar. Other options later on is like microneedling, lasers, like laser resurfacing of the scar, and those help a lot too.
All right. Thank you very much. That's it now.
Okay, thank you so much, you guys. I hope this helps. This will be also in my Instagram and YouTube with the What to Expect series, and I'll see you guys next Tuesday on Tuesday Tips.